If you've decided to proceed with a facelift surgery, it's important to understand what to expect afterwards. Every surgeon has his or her recommendations that he wants his patients or her patients to follow, and it is important to follow those recommendations. For my patients, what I like to tell them is that for the first 2 to 3 days, you're going to notice your swelling is going to increase. This is part of the body's natural healing process. That swelling is going to stay there for another 2 to 3 days, and right around day 5, it's going to start coming off. As a general rule of thumb, 80% of your swelling will be gone by 2 weeks, and 90% by 2 months. That's if you're using cold compresses in the beginning, as well as staying inclined when you sleep at night, at least at 30 to 45 degrees. That can be accomplished either in a recliner or in a bed using an inclined pillow. As far as what to do after surgery, I have my patients clean their wounds multiple times a day and then apply an antibiotic ointment over top. Studies have shown that by keeping those wounds moist, the area will heal faster. When the area heals faster, it's both more comfortable for you and decreases your risk of developing an infection down the road. Other things that I advise my patients is to avoid exercise the first couple of weeks. You'll notice that immediately after surgery, your body feels a little bit run down. That's to be expected. Unlike what you've probably been told the rest of your life where you want to push through things and get going faster, it really is important to listen to your body immediately after any major surgery in order to get the best long-term result. Starting around 2 weeks, I do have my patients start easing back into their previous cardiovascular activities, but it's important not to be using any upper body activity for about a month after surgery to avoid stretching the scars. Just like when you're listening to your body as far as the amount of activity that you can do, it's important to listen to your body with motions of the face and neck area. If you feel an area pulling, it's important not to pull against that area. Scars tend to defend themselves, and if you're pulling against one of your scars, it's going to respond by forming more scar. There are treatments we can do to help minimize that risk, but if you can avoid activities that put that stress on that scar to begin with, an ounce of prevention is worth a pound of cure.